Okay, good morning, everyone. Glad that we could have so many people in attendance with us today. We actually have a live audience, which we're excited to have Allison Riley here from Blue Bonnet Trails. So today we are going to give you an update on progress that's been made so far in the Employee Wellness Group. My name is Ray Langlois. I'm the Coalition Coordinator for the Wilco Wellness Alliance. We also have Kelly Becerra, who is the support staff and health educator from Williamson County's and City's Health District, and Melissa Tunn, who is the systems analyst with the WCCHD as well. We'll all be giving you parts of the presentation today, and then after we give the presentation, we'll have the opportunity to open up the mic and let you guys ask questions if you have it. And then you also feel free to type in questions in the chat bar. We do record these webinars so that others can have access to them, and we'll put those on our website at healthywilliamsoncounty.org. So today what we're going to be covering are just a recap of the 5 health priorities, as well as mid-year progress update. We've been working on our CHIP for the last 6 months, and so we'd like to talk about that as well as what the working groups have been doing. The CHIP update, a discussion, and next steps. Just going back through our top 5 health priorities, just a reminder that in 2016, the County Board of Health approved the community health assessment, and in that assessment, through several focus groups as well as surveys that were taken from the community decided that the top 5 priorities would be mental health, access to health care, awareness of health care resources, active living, and chronic disease. And these align really well with the Employee Wellness Group. Our Employee Wellness Group has several opportunities to work in this area, especially in the areas of awareness of healthcare resources and chronic disease. And so those are 2 of the focus points, I think, that the Employee Wellness Group's been working on this year. Kelly will kind of update you on that in a little bit. So just going over our mid-year progress from the last 6 months, talking to you a little bit about what's been going on in the Alliance. I know the Employee Wellness Group meets as a group, but sometimes it's good to know what the whole Alliance is doing. So just to kind of catch you up with that, in January we had a little bit over 500 members of the Alliance. We've actually grown to over 600 members in the last 6 months. We're very proud of that accomplishment since that's a 20% increase. We also have approximately 170 organizations represented to collaborate and create partnerships. Our working group membership is very balanced, and we're proud of that. If you look at the employee wellness line, there's 62 members in that group, which is about average with all the rest of the working groups. And so we have really great participation in terms of people who are interested in employee wellness in our alliance. We also have really good participation in our working group meetings. Our employee wellness group has met 3 times since January. They've averaged about 10 members per meeting. Now, this is about 6 members short of our goal of 25%, but we could hover around 15 people per meeting. That would make us really happy, because we could then feel like we have a fair representation of the larger group. All in all, though, all of our groups have had great attendance. We've had 82 consistent members through all of the groups that have made most of the meetings, and that represents about 45 organizations who are participating in the 5 working groups that we directly support. Some of our highlights this year, just in the few short months that we've been together, is in our working group meetings as well as our summit, we've had over 23 presentations from organizations and community partners. In our summit that was held in April, we've had over 102 community members attend, representing 60 organizations. We were really proud of the turnout, and we got a lot of great feedback from members who were in that meeting. So the support staff is also working hard around our county in our extended area of Central Texas. They've attended 21 meetings over the last 6 months and are members of 8 outside coalitions within Williamson County and also within Travis County and Austin area as well. The support staff has also presented and trained approximately 330 members on various topics such as healthywilliamsoncounty.org website, our community health assessment and community health improvement plan, the tobacco referral system that was just initiated this year, and Kelly can touch on that for a little bit, and then through General Alliance meetings and trainings. One other thing that we're really proud of is the West Wilco Community Resource Coalition being established this year. That coalition started in March, and it represents the communities of Liberty Hill, Leander, and Cedar Park. We noticed that there was a gap in community resource and coalition, a coalition for community resource members to join. So we talked to the good people over at the Hill Country Community Ministries to see if they could help us sponsor a group out there. And we have approximately 54 members that have joined, representing 29 agencies of our nonprofits in that area. We meet over at ACC in Cedar Park monthly. We have a webinar this month updating their members, as well as we'll have a kickoff meeting in September, and then they'll be back on a monthly meeting schedule. So I'm going to turn it over to Melissa, and she's going to talk about some of the other data that we've collected over the last 6 months. Melissa?
Okay. Thank you, Ray. I'm just going to talk briefly about the website, healthywilliamsoncounty.org, and then this past 6 months we've really pushed hard the resources and on the website to our working group members and also to the community. As you can see on the left side is just a graph of the users on our monthly website by month on our website, and then on the right is page views, and the blue lines is last year in 2016 and green is in 2017. You can see that our page views has really doubled over the past 6 months. And this past 6 months, we've ranged about 2,500 users, as well as 11,000 page views. In addition, Ray, do you mind clicking? In addition, we've really been increasing our local health data and keeping our health data current. Over half of our indicators have been updated in the past 6 months. So really thank you to our vendor, as well as we're in the next couple months we're going to try to get more local health data, zip code and census tract data. And Bertha is the community resource that we've also been pushing out. It's the way to find community resources by searching your zip code. And in the past 6 months, the top searches has been #1, health, #2, housing, and #3, food. And basically over 200 users per month have been searching, and that's approximately 4 searches per user. At the beginning of June, the Alliance sent out a survey to kind of evaluate progress that has been made through our working groups on the community health improvement process, as well as wanting to get feedback from our members. We believe it's important to really be in tune with our members and really provide the services they really need. And so I'm just going to talk briefly about the survey results. And so about 48 members responded to the survey, which is a pretty good amount. And as you can see, that there were 25 members that are actually new to the coalition, and so that's about half of the survey respondents, as well as the other half have been members from 2 to 5 years. And it's really good to hear from our new members and really get the feedback from them. And through our Community Health Improvement Plan, many of the working group members have identified collaboration and networking and promoting of organizational activities as main goals in their working group and in their action plans. And so we really wanted to capture that and see how many connections people have made, because we know that initiatives and partnerships can kind of blossom outside of the working group. And so 48 members answered this question, and about 7 said they weren't able to make any new connections from any activities this past 6 months, and actually they cited that either they were new members or that they would prefer more active networking opportunities, which is what we've kind of gone towards in those past couple of meetings. 27 individuals, about half, said they've made between 1 to 3 connections through our activities, and then about 14 of our members said they've been able to make 4 or more connections. And this actually, I asked members to share some of the initiatives and partnerships that they formed through these connections, and I got over 36 responses, which is awesome. And so I'm just going to highlight some of the examples of initiatives and partnerships. For example, from opportunities, I connected with Becky from Georgetown Head Start in the school health group, as well as Kids in the Car group from Dell's Children. Together we conducted a car seat safety check event at the Georgetown Health location, where we're able to distribute about 25 car seats to low-income families. That is awesome. And also other organizations mentioned our Brothers Day Food Pantry, Run Rock ISD Parent Group, Life Steps, Medical Mission at Home, and Central Texas Food Bank. Additional examples include energy balances being reintroduced at Head Start with Kelly. Other organizations include March of Dimes, AmeriGroup, Texas AHEC East, ACC, St. David's, and Livingston County EMS. Lastly, one specific employee wellness example is Catch My Breath e-cigarette program. He or she met catch representatives at the Wilco Wellness Alliance meetings and found common interests with tobacco prevention. Now serve on the Catch My Breath steering committee. So that's awesome. And then also, we are trying to get together an employee wellness group, and we'll be reaching out to the American Heart Association contacts. And we really wanted to understand some of the benefits of Healthy Williamson County and what has been beneficial to our members. Number 1 was the community events calendar, and you can actually, many of our members have been submitting events to this calendar, and if possible, organizations can also actually embed this calendar into their website. Number 2 is health and population data. 3rd is working group and community group information. We asked members to kind of rate the services that the Alliance provides, and number 1 was networking and collaboration. Number 2 was learning about other agencies and organizations, and 3, the community health improvement process. And you'll continue to see these 3 items being pushed in through our working group meetings. So for current member support for the Alliance, we really believe in a partnership with our Alliance members, and so the number 1 thing, over 80% of respondents said they participate in our events. Number 2 is that they promote the Alliance, which is awesome, and number 3, they use our community resources. In addition, we asked how our members can further support the Alliance, and they said that, number one, they'll continue to promote the website, healthywilliamsoncounty.org. Two, they will participate in the CHOT process. And number three, they'll continue to promote the Alliance through presentation. And one last question, we asked members how we as Alliance can further improve, and we take these feedback and suggestions really importantly. And number one is to support and promote member activities, event, and outreach efforts. And we will continue to do that through our newsletters, through our website, through the working group meetings, through presentations. Number two, increase networking opportunities. And three, continue to seek funding to support working group activities. And now I'm going to hand it to Ray.
Thanks, Melissa. So now I'd like to update you guys on the Community Health Improvement Plan. The Community Health Improvement Plan was approved by the Board of Health in January of 2017. It's a plan that covers 2017 through 2019, so we're just in the first 6 months of that plan. But we've had a lot of work and a lot of progress made. Just to show you a little bit about what we put together here is trying to look at all of the working groups and the progress they've made. We're very excited that on the all the strategies that we have in progress right now, 64% of the strategies have already been started, which we think is really good progress for a 3-year plan in the first 6 months. The Employee Wellness Group has 10 strategies that are already in progress. You guys are light years ahead on what you're trying to get accomplished, and 3 of those strategies are still to be begun. Kelly will go into more of that later. The strategies are just part of what we try to do in the working groups, as well as the collaborative activities, the networking, and the learning opportunities. But we really feel like if we can work on these strategies, that it'll be important for us as we continue to improve the health of everyone in the county. So now I'm going to turn it over to Kelly, who's going to go over the Employee Wellness Action Plan.
Awesome. Thanks, Ray. And so really what I want to start off by doing is just reviewing our goal for Employee Wellness Group. So the goal is to engage employees and employers in the community to provide and promote employee wellness and healthy worksite environments. That's really our overarching goal that we want to focus on, and all of our objectives and strategies really flow from that. And so on this first slide, it's really focused on awareness and gathering employee wellness resources and identifying what employers are doing really well so that we can kind of share those best practices with all who really seek those services. And so if you look at the slide, all of our strategies are already marked as in progress, as Ray was just talking about, because we've been able to share a lot of resources through our website. We're really fortunate to have healthywilliamsoncounty.org, and Melissa just kind of overviewed how people are using it, and a lot of people are using that site for the resource hub. And so we do have our own page on there for the Employee Wellness Group, and we're going to continue to put resources up there as we identify them. And that's something that we're really going to be focusing on is what toolkits do we want to use, what resources do we want to identify and share so that we can really standardize that and push that out to employers and those who need the services. So in our last meeting, we talked about the CDC Workplace Toolkit, and we were possibly using that. We actually took that toolkit back to our own worksite committee at WCCHD, and we went through the first process of that, and we really enjoyed it. We just did some check the boxes to see what we were doing well and what we weren't doing well. So we're actually starting that process internally as well. So it's really fun to do, and we can definitely keep looking at resources as we go. So again, just encouraging everybody to remember that we do have our own employee wellness page on the website, and that's really where all these resources and best practices are going to live. So looking at this second slide, we're focused on capacity building. So this objective is really focused on growing our employee wellness group and having more participation in those meetings so that we can double the group over the next years. So as Ray talked about, we really would be happy around 15 or so active members. And so for us to do that, we really do have to make an effort to reach the right people. Who do we need in these meetings? Who are we missing? I think from what we've seen, we really can work harder to get these large employers involved. I mean, Williamson County is a huge hub for these largest employers. If you look at Dell, you look at Emerson, we recently were reaching out to them. So there's a huge opportunity for us to involve these large employers. But of course, the challenge, which we found so far and which we're still, working through, is finding that right contact. So I think we're going to have to work together as a group to identify these businesses, these organizations that are missing. And we just have to think about, who's the right contact here, who can we invite, and then how do we sell this group to them? Because we really do want to serve, again, with the resources that we're going to be building and providing. We want to serve as a resource hub, but we also want to be collaborative in our meetings as well. So getting the right people, it would be really important to have that collaboration all together. So moving to collaboration, this objective is really focused on building the relationship with those who provide the employee wellness services. So we've talked about, okay, well, we're putting resources up, things that we're identifying, but what about the people who actually provide those employee wellness services, and do we know who they really are? So that's really what this objective is about, for us to be better at knowing who's providing these services so that when employers come to us, we can say, hey, we know somebody who would do that program. So just looking back at one of our meetings, we had Dusty Young from the American Heart Association. She came in and spoke about AHA's check change control program, and that's really a blood pressure control program that we actually use internally as well at WCCHD. And so the fact that she was able to share that is really a wonderful opportunity for those, who are in the meeting to learn more about her services. So we do hope to continue to invite those who do have services like that. We hope to invite them to let us learn more about what they do so that we can all try these services out or push these services out to employers. And then, of course, we're working really hard to attend other meetings. We attend the Austin Business Group on Health in Austin. That's a really great opportunity that we've had to network with these services as well and get to know these services as well. And then, of course, we're networking with people who are those HR professionals. So we're working really hard to build these solid relationships with these organizations, and that's really where we are in progress currently. So that's the update for Employee Wellness Action Plan. So I'll throw it back to Ray.
Great job, Kelly. Thanks, and great job for the Employee Wellness Group. I mean, really, like I said, you guys are way ahead of the game on a lot of things. And frankly, employee wellness is going to have a leg up because a lot of our businesses and corporations put those things together. I was just wondering if anybody had any questions or discussion items or any need to know at this point. Okay, so, and that's okay. We can, you guys feel free to email us. We'll put our email addresses up there later and talk about it. I know we've met a little bit more with talking about some strategies with our employee wellness group. We did a community assessment. We're really excited about some of the things that we can roll out. We're going to have a kickoff meeting in September for your group. And in there, we'll probably be able to tell you a little bit about more about some of the things that we're going to do. So just let's talk about next steps. We've gotten through the first 6 months of this year, and obviously we have 6 more months coming up, and we have a few things left to do so that we can measure our progress over the first year. And so in those next steps, what we're asking to do is for you guys and ourselves to continue to promote the community resources that we have available. Currently, we use things like Aunt Bertha, the community calendar, promising practices that are found on the healthywilliamsoncounty.org website. We are going to meet with It's Time Texas in very soon to look at a couple of apps that they have. One of them being the Choose Healthier app, which gives you ideas of where opportunities are for physical activity and nutritional, healthy nutrition opportunities in your area. So we're looking forward to finding out ways we can use technology in order to enhance the opportunities for employee wellness in our group, as well as trying to align with national groups such as American Heart Association to look at how they put their employee wellness packages together as well. Update, one of the other things we'd like to do is update the working group performance measures. So at the beginning of the year, we took some baseline measurements of how employee wellness was doing in our in our county. We also did a county assessment for the Healthy Texas Communities assessment, and we're putting those two assessments together to talk about a little bit about where we are as far as our performance measures, and are we making a difference with the initiatives that we're involved in. Also, we're looking to create a plan to improve member engagement in the meeting, webinars, and in other things that we do together. So we're looking at strategies to keep members engaged, if that includes technology as well, and then also ways to invite members that, like Kelly said, that we might not have at the meeting that we haven't thought of inviting to the meeting. And lastly, what we're looking at is focusing on moving all of our community health improvement strategies from not started to in progress. I think you guys had 3 of them that we could probably move into in progress, and then the performance measures would take over from there. So really great work this year. I applaud everybody who's worked in the employee wellness group. I think everybody's very motivated about getting this group moving. We're in a challenging position. We have a community that's growing rapidly. We have an employee, it has a low employment rate, so that means it has a high employment rate, which means employee wellness takes care of about 85% to 90% of all the individuals who are working in our community. So it'll be very important for them to do that. I know that Kelly has a really good tobacco cessation program that she wants to show you guys. So I know in the coming this fall, we'll be talking about tobacco cessation as one of our ways to help employees and employee wellness, as well as improve chronic disease in our county. So if you have any questions or any ideas or thoughts, please feel free to email us. I just wanted to show you the emails that we have up here. Kelly's is up there, as well as Melissa. Feel free to reach out to us and ask us questions. If we can go out to your site as well and talk to people about employee wellness. I know Kelly also has a sleep program that she can talk to your employees about. She's done that in 2 organizations so far with great success. She's also has a physical activity program that she's done in one of our school districts, and then she can talk to you about tobacco cessation. So I think you could really utilize her as a great resource. And of course, Melissa and I are always here to help you as well if you need help with the website or data or anything like that. So if there's no questions, we will go ahead and wrap up our webinar meeting today. I appreciate everyone taking time to kind of listen to what was going on today. Again, we would appreciate any feedback if you have some.